Today we're going to talk about bony anatomy of the shoulder. Okay, so we're going to talk about the anterior side of the shoulder first. And we're going to start with the manubrium. And the manubrium is the top part of what you normally think of as your sternum. And then right below that you're going to have what is actually called the sternum. And just below that you're going to have a thing called the xiphoid process. Now the xiphoid process is a small little tip that you try to avoid during CPR. You don't want to break that off when you're doing CPR on somebody. And then we go back and we have the ribs. One thing that's special about the ribs is, or interesting, is that most people don't realize that you have ribs so high up. This is actually right here your first rib, and it wraps around here and comes to the manubrium. So you'd have your first rib here, your second, third, fourth, fifth, and so on. And they just go down the line. And then along with the ribs you're going to have a costochondral junction. So you're going to have where the ribs and the cartilage come in and meet together. And that happens right in the front of your chest. So these little lines I'm drawing here are the costochondral junctions of the ribs and the cartilage. And then what we normally think of as your collarbone is called your clavicle. You have your arm bone, which is the humerus, and you have a couple bumps on your humerus that are attachment points for muscles. And the first one that we're going to talk about is the greater tuberosity. So it's right there, and I'll draw a little dot where it is exactly. This is the greater tuberosity. We'll be able to palpate that better when we do our palpations. And then if you have a greater something, you guys have learned now, you have a lesser as well. So your lesser tuberosity I'll color in green. It's a little hard to see on this slide, but it's going to be a little bit more medial on the humerus. And then the last thing I want to talk about is the coracoid process. So it sits right here on the scapula. So that's your coracoid process. And it's just a bony protrusion that comes off of the front side of your scapula. Now we're going to talk about the back side of the shoulder. And what really comes into play here is your scapula. So on your scapula you have a few bony landmarks that are going to be important for you to remember. The first one is your superior angle. And just thinking about the medical terminology words, you know superior means above. So this angle here is your superior angle. Okay. Then you're going to have, if you have a superior something, you're having an inferior as well. And you have your inferior angle down here. So this section here is your inferior angle of your scapula. And then you can see that there's this nice long section here that is called the spine of your scapula. Okay, so that's the spine. And at the end of the spine, you're going to have a bony prominence called an acromion. And that is right here. You have your acromion. And you can also see that from the front of the shoulder as well. And then again, from your medical terminology words, you're going to know that you have a medial border and a lateral border. So your medial border is going to run along this side on the medial side, and your lateral border over here on the lateral side. Okay, and we're going to talk about 4 different joints that occur in and around the shoulder. And what you normally think of as the shoulder joint is called the glenohumeral joint, and that's occurring right here under all these ligaments that you see. So the glenohumeral joint is what you think of as the shoulder joint. And then you have the acromioclavicular joint. So the acromion was a little bony protrusion off of the scapula, and then the clavicle comes and meets it, and so that occurs right about here. So that is where your acromioclavicular joint is. And then your sternum and your clavicle, really your manubrium and your clavicle, come together and make the sternoclavicular joint, and that occurs right in here. So that is your sternoclavicular joint. Now the next one isn't really a joint, it's called an articulation, and it's because there's no actual attachment, it just floats there, and that is the scapulothoracic articulation. So you can see that in a few different places. It's going to be, right here is the scapula, and then your ribs, so you just have to imagine in a 3D picture that the edge of the scapula and the back of the ribs are going to be touching. And then you can also see that over here with the scapula, kind of right where I have scapulothoracic already.